Buprenorphine is a life-saving medication that we use for treating individuals with an opioid use disorder. It is described as a partial agonist at the mu opioid receptor.
What this means is that its effect on the opioid receptors in the brain is partial, or somewhat, I'd call it like halfway, compared to other opioids such as fentanyl, oxycodone, morphine.
When someone has opioid use disorder, that's really defined by compulsively using opioids despite bad things happening to you. And people with opioid use disorder have had a shift from using opioids to feel good or to feel relief to needing to use opioids just to feel normal and just to not feel sick anymore. And so that traps people in this terrible cycle of spending much of their day finding and seeking and using opioids.
So with that halfway effect, it'll fill up all those receptors, essentially meeting the patient's need for opioids while reducing their risk of overdose and other negative effects.
It keeps patients out of withdrawal. That's so critically important for patients who are struggling with addiction because it stops these highs and lows, and the lows are incredibly uncomfortable for patients.
Buprenorphine saves life by preventing overdose, helping with withdrawal cravings. It's helped a lot of people in their journey to recovery.
People can get the medication prescribed from their doctor, like any medication, like a blood pressure pill, pick it up and take it every day.
You don't have to be specialized in addiction medicine to understand why buprenorphine saves lives and why it should be a part of any treatment discussions you have with a patient with an opioid use disorder.
You don't have to be a specialist to do this. You don't have to go through a whole fellowship training. You don't have to be an addiction medicine doc to do this.
It's completely safe for prescribing and for patients to pick it up themselves and take it through outpatient clinic.
It worked for me, and it's an opportunity to get sober and give you a normal life.
You can be able to have it accessibly for a lot of people that need it and readily in the moment that they need it.
There are many providers in the addiction team that are more than happy to answer your questions and help you get started.
People have the right to live longer and have a better life.